precautions that one needs to take is to make sure that if he is a smoker, then he refrains from smoking for a reasonably long period of time. I would suggest about 3 to 4 weeks before the placement of implants and at least 2 months after the placement of implants. This is very important because it has been adequately established that if the person is a smoker in whom implants have been placed, the possibility of acceptance of these implants in that patient's bone reduces substantially, which means that there is a possibility of a failure. We are looking at exfoliation or no integration of those implants in the surrounding bone. So this is one precaution that the patient will have to take. If he is on any kind of habits of, say for example, gutka or supari chewing, he should refrain from that, because all of these habits exert undue stress and pressure on this implant which has been recently placed in bone and is in the process of healing. Other precautions that the patient needs to take are related to his medical conditions, and he has to make sure that whatever medical problem that he may be having, his blood pressure, his diabetes, his high cholesterol, he is taking those medications well, and these conditions are well under control. Around the time of implants, there will be a few blood tests that the doctor will be prescribing. These would be related to knowing the health of that patient, especially related to his platelet counts, for example, that his blood parameters are well within normal limits, his blood sugar is well within normal limits on that day if he happens to have a high blood sugar. And we also do what is known as a bleed profile, and this is done to establish that the patient is not going to bleed excessively during the surgical process. So these are some of the precautions that the patient needs to take before he can be in the chair and we start the procedure of placement of implants.
For more on your health, log on to health.india.com.